Hi, hello, namaste, welcome to our channel. Nowadays, dentistry has become a wide variety of vast subject and so many dental problems we are facing and a number of patients we are looking and so many dental clinics also there. So what is dentistry and what are the problems you are facing? So here we have Dr. Shweta Kiran Gulve and she's a chief dental surgeon at CornealDent and Ashoka Private Limited and also one of the founders. Hello Shweta, how are
Hello,
you?
I'm good. How are you?
I'm good too. So, first of all, there's a vast dentistry. Now people have so much of awareness. They are getting to know what is dentistry and all.
Yeah.
Can you please elaborate briefly about dentistry?
Yeah. So dentistry, as we all know, we think it is related to just teeth structure, right? But actually, dentistry it includes surrounding structures as well.
Definitely.
Like gums, tongue, also TMJ joints, both jaws, all are related. Okay. So and dentistry, we won't know that, but it has 10 sub branches, 10 to 12.
Okay.
Okay, so I'll start with one that is endodontics, which is the most important branch. Okay, then periodontics related to gum structures, prosthodontics replacement of missing tooth, then implant dentistry which is widest now, then laser dentistry, again oral and maxillofacial surgery, then periodontics I told you about gums,
Gums.
right? Then about pediatric dentistry which is mostly related to the kids.
Yeah.
Yeah. So, and also public health dentistry, which is more concerned with the general public health of oral health. So, we can look dentistry in a vast manner,
Yeah.
and we should be very aware of it.
Okay. And usually the dental problems are like very common nowadays. Usually in the pediatric people like children, pediatric dentistry or pediatric prevention. What are the common dental problems the pediatric population is facing and it is very difficult to prevent them. So,
Yeah.
but still what are the ways to prevent them?
So, like we all know, children like sweets and they don't want to maintain it.
Yes.
So, most important problem is dental caries, or in common layman languages, we say cavities. Okay. So, cavities, they can be painful. Many years they will be like that. So, little discoloration, we will think ki it's just like that. And mostly parents are also not aware, because in generally what we think.
Usually children don't complain. That is the
Yeah,
reason.
children don't complain, and as a parents or as a like caretakers, we feel these are milk tooth. This milk teeth will go eventually. So why we should like invest and like why we should take kids to the dentist? But this is the most misconception among the people. So because this pediatric dentistry, it plays very important role. Like if you won't prevent that teeth, they'll give them lot of pain, and the permanent teeth that will come, they will not be come in alignment. So parents should take their kids as soon as kids complains, or they should brushing should be done by parents only until 5 years. The technique should be proper, like the round technique we say. Okay, then fluoride toothpaste, which are very must for the
So
kids.
the circular motion.
Circular motion should be there. Fluoride toothpaste should be used, and many other factors like not giving sweets in between the meals, which is very important. If kids like they want some or the other thing they will want, so that time we should look after that they rinse their mouth at that time only. Okay, after before going to bed, at least if kids are not doing brush, they should rinse their mouth. This should be a regular habit for the kids, so they can maintain the oral hygiene very properly. Then they should be taken to dentist in every 6 months, which is very must. So all these small precautions can help you.
Okay.
Yeah.
And usually the normal children only, it is we can face a lot of
that's
difficulties to make the hygiene, like oral hygiene. What about the people like children with autism and ADHD? What are the dental problems they will face, and what are the dental issues they are going to have?
Yeah. So in special, like in normal kids only, we have to tell them repeatedly, and they won't listen at all. So in special kids, we have more challenges. Like until 7 years, we have to monitor the normal kids, their oral hygiene. But in special kids like autistic kids or special like other Down syndrome or many things, we have to monitor them like whole life, max to max. Okay, but we can also teach them. Like in a Down syndrome, the cavities will be less, but they will have more gums problem. Yeah, like bleeding gums and all. And in many special kids, the malalignment problem, like teeth won't be in the proper positions. They, in some kids, the teeth will be crowded. Okay, in such situations, the plaque will be more. The Because of that, they'll have more caries, more problems, and also they cannot express the pain.
Okay.
Yeah. So it's a duty of a caretaker, of a parent, to take them to dentist and to teach them properly. We also teach the parents how to brush, how to monitor, and this way we can teach them also. We
Okay.
can teach the kids also. We can train them. Also, some electric brushes are also coming,
Yes.
but manually is very important, and we should always take care of that.
Okay. Does dental problems affect the overall body metabolism?
Yeah, it does. Actually, it has been neglected for so many years, like dental issues. But as we all know, diabetes mellitus is most commonest problem. Okay, the early signs can be seen in mouth as well.
Wow.
Yeah. Also, then many signs like endocarditis. Okay, so because of periodontal problem also it can increase. And even we don't know, like oral structures also affect in pregnant women also. Then other many important signs of cancer, syphilis can be seen in oral structure only.
Okay.
So it's very important that we look for this sign and go to dentist if we have any doubt, any ulcerations, anything.
So nowadays the implant dentistry is considered as an advanced thing.
Yeah.
So what is this implant dentistry? Can you please explain about
Yeah.
it?
So implant dentistry, like what happens in previous ages, replacing teeth was like very difficult. Either the replacement was done like removable and fixed. If we need to be fixed, the teeth structure should be sunk, the surrounding. But nowadays, if your bone is proper, if you if you are not diabetic, like in some diabetic conditions also we can do it, but it has some range. Okay. So implant dentistry, what we do, we implant a screw inside your bone. So it will,
Okay.
yeah, so it will be just like your natural one, and it can be a same load, almost same load as of your natural tooth. So what happens, you can be very happy with that, and the normal life you can sustain with that. So there are some ways to play, like some precautions needs to be taken for 2-3 months, and some dental x-rays need to be taken first, but mostly it is most advanced and it is most best if
So
you go for
depend.
that.
Okay. So the implant dentistry can't be applied for all the patients.
Yeah.
We heard that. So
Yeah.
it depends upon any bone structure or the age or anything.
Age factor, yeah, it plays an important role, because in young patients, as we know, the bone formation will be more as compared to the geriatric patients, but it doesn't limit that. Means age factor won't limit every time. Like if your bone is sound, if you are like healthy person, you can go for implant. It's
Okay.
your doctor will definitely see all the conditions and will do the things. So only some precautions and you will get your teeth back.
Okay.
Yeah.
So what are the advancements you're approaching in dentistry?
Like advancements, what we can say, like implant is one, then laser dentistry, then micro dentistry, we can do root canals through microscope. Okay. Then laser dentistry is very important nowadays. Again, smile designing, cosmetic dentistry is like the most advanced field everyone wants to. Like previously it was said ki we cannot go for a good smile just easily. We have to go for braces. Now in smile designing, we can go for artificial dimples and all that things. So now everyone, each individual can go for good smile. That is the most best thing.
Okay.
Yeah, and it's not like everyone can get a good smile with good oral hygiene.
Okay.
Yeah.
So what is a more prone disease in children apart from dental caries? Like.
Yeah. So bleeding gums.
Okay.
Yeah. So like in my clinic also, or in many clinics, first complaint is caries and second one is bleeding gums or sensitivity. Okay. So bleeding gums mostly because of plaque depositions. Okay. Why plaque depositions? Again, not brushing properly.
Okay.
Okay. So circular motion brushing, and teaching kids again and again how to brush, monitoring their brushing, and monitoring what they are eating. not only in kids, also in adults or in every age group, this can be monitored and can be prevented. Also, bleeding gums can be treated with many things like little cleaning or scaling. This can help using mouthwash.
Okay.
Mouthwash we can use in adults. And very simple floss
Yeah.
methods are there. Okay, then interdental brushes, this can all help you.
And especially in India, people don't go often to the dentistry and
Yeah.
dentist actually clinic. So how often we should visit dentist?
Yeah, actually, in every 6 months, it's mandatory. Because in every 6 months, your perioral structures will change somewhere. Okay, so many times people will come and say, "Ki, no, doctor, I was not having anything before for 4 days, 5 days. This happened only in this week." But it's not that. As we all know, it takes like months and years to form that. So if you come in like a preventive stage only, then it can be prevented.
The treatment
easily.
is very minimal.
Very minimal and very easy. And less painful, because patients doesn't want to come because of one thing. First is like they're very apprehensive towards the treatment, like they'll have a lot of pain or injections or misconceptions. And second, also the cost of the treatment. Like it is mostly said dentistry is costly. So dentistry is not costly if you come at early stage.
Okay.
Yeah.
And what are the basic precautions we need to take to avoid dental caries and any other dental problems?
Yeah. So twice brushing, it's really mandatory, and 2 to 3 minutes brushing is sufficient. So if we take out 5 minutes of our day, it will be minimal. Okay. Then proper brushing. Okay. Many people don't know the proper technique to brush. So whenever like in many YouTube videos also, they'll show easily in in all ads also, or you can ask to your dentist, they'll guide you nicely. You can educate your surrounding people for that. Okay, so first is brushing, then second is whenever you eat something, rinse your mouth. That is the most basic things we can
So rinsing
do.
is a plays a major role actually.
Yeah, it looks like very minimal thing, but it plays a very major role to form that cavity, plaque, everything. Okay, so this small things can helpful. If you feel like little discoloration, sometimes we ignore it, what it is. Just going and feeling that will prevent you root canals.
Yeah.
Okay, and again, you can see your gums. You can check your gums also. Is there any swelling? Or if you feel like bleeding gums, like bleeding is frequent, some people will ignore that as well. So when they once get sensitivity, they'll come. So before that only, we can go for like small scaling procedure, and that can be prevented.
So finally, the oral hygiene is very, very important
Very
in regard to
important.
all over the
body, and
actually.
it is said that your oral cavity is mirror of your body metabolism.
Wow,
Yeah.
definitely.
So I think we can know it, and food will enter through oral cavity only.
Yes.
So we should always see that and monitor that.
Okay. Thank you so much, Dr. Shweta. Thanks.
Thank you. Thank you so much.